So let me first of all start by apologizing for this weekend failing to fulfill my end. I'm sure Susan explained to you all. I had some estate errands to run and some family responsibilities to do in town. So by the time I got done, there was no way I was going to make it on time. And then Saturday, that one is a big apology. I assumed our class was 7:30. So many apologies for that. But I thank you for quickly organizing time for us to make up. So today we are going to cover, we're going to just finish up the introductory part we did last week. We're a bit tired, so I cut it short, but we're just going to complete it. The lecture slides are there on Moodle. I have just changed them a bit and I've re-uploaded them, but they're basically the same. And then we shall look at research design. For tomorrow, I was thinking to ease in the burden for the week, I will put up a pre-recorded lecture so that we don't have a physical lecture. And then we have a discussion on Friday when we meet. This will be on problem identification in research. So I'll put up that pre-recording tomorrow. I've also just uploaded, I uploaded and shared our two videos for the last lecture we had. Once ICT links them, I will link them in Moodle. So I hopefully that will be done today, if not tomorrow. So let me just share my screen. And we can look at our lecture slides. Remember, we looked at the introductory part. We're just going to complete that today, introduction to research methods, and then we shall look at research design. So let's just complete research methods, look at validation specifically. I think just in summary, what we did, we looked at the research methods. We looked at, I think the last topic we discussed was research methods. And then we looked at the three generic research methods where all others fall, which is, exploratory, descriptive, and explanatory or analytical. Just to recap on those two generic research methods, or rather just to remind ourselves what these research methods were. We looked at several of them. We looked at, for example, case study, ethnography, design science, which is unique to ICT and IS, action design science, and quite a number of others. But at the end, we say that all our research methods essentially fall under these three generic research methods: exploratory, descriptive, and explanatory. So just to recap a bit, I gave a detailed explanation, which is there as part of the recording as well. So what exactly is when do we do an exploratory? When can we say that our research is exploratory? We can say that it is exploratory when we are trying to find out about something new, something that is not yet clearly understood or known about a specific phenomena. For example, if we just look at the case of Uganda right now, we're in the case of COVID-19. I'm sure when it hit in 2019, this was a new phenomenon. Another new phenomena could be maybe how people are responding, how communities, how families, how individuals are responding to the pandemic, how it is affecting them. Another area we could explore is, for example, how organizations have responded, especially in regard to ICT. And so, and this can be in any, we can look at it in any way, our e-readiness, governance, our governance readiness, in terms of, do we have policies, do we have strategies, what is available, our ability to work remotely, considering all the ICT resources we have, is it possible? Then if you look at the area of academics, how have learning institutions managed to respond in terms of e-learning? So many things. These are all new areas. One could say that let us go out there and explore. So we are essentially saying to explore is to try and find out what is happening, to seek new sites and to ask questions, to assess the phenomena in a new light. This is essentially what we are saying when we say we are doing an exploratory research. So how would we carry out this exploratory research? Well, we start by scanning through literature, what literature says. Well, all research begins with literature, essentially. It begins with literature. But some areas can be quite new that even literature may not be helpful. You may want to first talk to experts in a specific area. Conduct focus group interviews. So when you look at all of these, you really see it's really a qualitative approach. You're seeking to find out, you're seeking to understand. Quite different from the quantitative approach. So for exploratory, things are quite flexible and adaptable because you don't know what it is you're going to discover. It's unlike the quantitative approach, or when we shall look at the others, where everything is severely controlled. And we shall see quite a bit of that in research design. So there's a need to be flexible and adaptable while maintaining a certain direction. What do we mean? Let us say we are trying to understand how organizations have responded to COVID-19 with their available ICT resources. We are trying to discover, we don't know. We don't know how organizations have responded. We don't know how different institutions and industries have responded. So essentially, we're going out to discover. So as we're going out to discover, we may have an idea. You may go in, let's say, with your approach, you want to find out what resources are available and how these people, you may look at two things: what resources are available to institutions, and what and how they have used them to respond. Now, once you get into the actual context to try and discover, you might actually find the resources you assumed existed actually not there. So then you might say, well, what approach should I take here? What should I take? The resources you assumed that were there were not there. Then you may readjust yourself and say, okay, so how have they used, what resources are actually available and how have they responded? Well, you might find in some situations, people have decided to completely let go of ICT and say, for me, I'm going to go face to face, come what may. I was talking to my sister, and she was telling me that two of her colleagues were found where they were found positive with COVID-19. And she said that one of them, in particular, one of the reasons he got infected was because he simply refused to use everyone else in the office. Others were meeting clients remotely, but for him, he insisted on face-to-face. And unfortunately, he got infected. So now that is a situation where you find this organization did have ICT, but refused to respond. Now, you may decide to ask yourself, okay, should I continue and this line of should I continue with this angle that I've found, where there are people who have refused to use they have the resources but have refused to adopt them. Well, you may say you may do that, but it may also derail you from what you're trying to discover. You may decide to say, this is not helping me with my direction of my research. I specifically want to find out those who have resources, how they have responded to them. That's what I want to find out. I may not want to find out those who have negative attitudes towards this ICT, but those who do have them and how they have responded. You may want to take that angle, that you may not want to be derailed. So that may be something. But however, whatever the case, there's need for flexibility and adaptability when you're doing an exploratory research. The second was descriptive. We also looked at descriptive and we described it extensively. But just to recap, here you want to portray an accurate profile of a certain event or a certain phenomena or certain individuals that are under research or that are of interest, should I say. You want to provide an accurate picture of something that is known but is not yet clearly known. So this can be an extension of exploratory research. Maybe there's already been some exploratory research done, but we want to understand more. We want to have a more accurate understanding, have an accurate picture. So it's an addition. Now, as you're going through your literature review, trying to find out your area of interest, an area that you want to research, in this time, you try to find out how much research has been done. So you determine whether your research is going to be exploratory, descriptive, or explanatory. That's what you're trying to discover. The third we looked at is explanatory. So explanatory, this is when something is known, there's a clear understanding, but you want to find out causality. You want to diagnose the relationship between variables. Here I'll give you an example, which we shall find in the next topic. We're going to look at research methods, research design. Sorry. Let us say we want to find out the scientists researching COVID-19 want to find out the effect certain drugs have on the COVID-19 virus or the COVID-19 symptoms. Just an example. There have been so many discussions and so many things have been understood so far. Recently, somebody sent me, my sister sent me a recording of a lady who was describing her experience. She and her entire family got infected, and she was describing the different symptoms. And then she went ahead to describe the medication they're taking and some of the remedies they are using, like steaming. And she went on ahead to explain how the steam helps to loosen up that mucus that affects you when you are infected with COVID-19. Then other people also brought up the use of steroids that you find in inhalers. Now, then later on, there's also other findings people have found, let's say in India, where they have been using steroids to treat COVID-19 patients, and Those who have recovered have also again been infected by a disease called black fungus, and they believe it's because of the use of steroids. Now, somebody can say, okay, can we actually do research to find out if using these steroids actually does cause or does lead to one being infected by the black fungus. So that research would be explanatory, in essence, to see the causality, or the causal relationship between these two variables, steroids and black fungus. Somebody who has been extensively treated with steroids and what's the relationship between that and the fungus, black fungus infection. So that is a typical example of causal, a study that is trying to establish causal relationships. One may also decide to let's say in the area of ICT, when one decides to, let's say, research on maybe the effect of adoption of an ICT technology in relation to governance, existence or lack of governance and adoption, if there's a causal relationship. Others may look at literacy levels, education levels, and so on and so forth. Success of ICT, how heavily it is used, depending on governance and all of these governance structures. There are so many things. One can decide to determine the causal relationship between an IS design, the design of an IS system, and its adoption, or its effectiveness, and so on and so forth, its ease of use and how effective it is, that causal relationship. All of these one can try to understand that kind of research. Do we have any questions before we move to the next topic? I know we discussed this extensively, but we may have forgotten. But do we have any questions so far?
No questions from me.
Okay. I have a question, Doctor.
Yes, please.
This is Tom Semgoma.
Yes, Tom.
You've talked about this causal.
Yes.
If I want to estimate, let's say, customer relation in line with the innovation, product innovation, can I use this concept to show the cause and effect, showing some relationships using, those causal groups, and to determine the cause and effect of that variable, where innovation, product innovation can retain customer or can satisfy the customer in a certain given company?
Yes, that would be a really good bit of research, and one of the things probably you would also need. Remember, when you're doing explanatory, you would probably need some also good backup to show. By the time you do an explanatory study, there should have been extensive research done before. And as we go a bit further, you realize that once we are doing a causal relationship, one of the key things we are trying to, one of the key things we start from is a hypothesis, which means that that research area which you've gone into must have had quite a bit of research, and it must have existing theory, which then has hypothesis, which means you would have a hypothesis in your research which says product innovation brings about customer retention or supports customer, something like that. And this hypothesis must be supported by an existing theory.
Yes.
Yeah. So
but
that one. Sorry, so.
Hello?
Yes,
yeah,
please.
There are some other variables that can affect this cause and effect. Take a situation that we are having a population in a given, like in a given area. We want to determine the number of customers we can obtain in a certain given, sector. For example, we want to come up to get our targeted customers.
Yes.
But within the targeted customers, that are within a certain population. Is it possible, like, to relate so many variables? Like, let's say, for example, we are seeing, we are relating customer satisfaction, but the customer satisfaction, we are deriving it from population.
Yes.
And then we get other factors and, converters from, the population that contribute to the population, then population contributes to customer satisfaction.
Yes.
How can I really phrase that in these explanatory studies?
Okay. Let me try to understand what you're saying. We started the discussion from innovation brings about customer retention or satisfaction, product innovation, something like that. Now, but however, we also understand there are also others. There are also other things that can actually bring customer retention or customer satisfaction. Now, this is a key point, and we shall discuss this a bit further when we look at research design.
All right.
When we are looking specifically at quantitative research, because this is very much type of quantitative research. This is heavily leaning towards quantitative or positivist style of research. When we are looking at it, we have to be very careful about our variables, that we don't get something that gives us results that we don't want, or results that we are not interested in per se. If we are looking at a customer, why a customer is retained in a certain establishment, there are different, like you said, there are different reasons. Someone, like, for example, someone may ask you as students, why are you UMU students? And you have different reasons. Someone will say, oh, maybe my brother, my sister was in UMU. Another person would say, oh, the course that I wanted was in UMU. Another person would say, oh, maybe for me, I came because I am a Catholic and I want to go to a Catholic institution. And maybe another person will say, I was there as an undergraduate and I know the system, I know how things work, that's why I'm there. You see, there are different reasons. Another person will say, oh, because they have, they are studying online, and at the moment, this is what suits my schedule. Now, if you as a person want to look at student retention and online learning, the advice would be, don't try to ask for other variables that you're not interested in. Focus your tools on looking specifically at that variable.
That's great.
Yeah, and remove the unnecessaries, because if once you get the other unnecessaries, then it's going to be a problem. It's going to be a challenge. It's going to
widen the research.
Yes, it's going to widen the research and give you results that really don't help with your research to prove or disprove your hypothesis. So, so that is something we're also going to discuss a bit as we go to research design.
Thank you so much.
You're welcome. So let us look at multi-method approaches. So when we've looked at the other three approaches, or the other overarching methods, one was the first exploratory, is very much qualitative. And one of the things, as we go to research design, one of the things we're going to discuss, and briefly as in the slides that come in, is the issue of validation. When you do your research, you want your research to be applicable elsewhere, that this is taken as an objective truth that another person can comfortably use. For example, I gave you the example of the term theory or the term model, which says a user will take up a system because it is, 1, useful, 2, easy to use. Those are very simple aspects that any IS designer would lean towards. Anyone who is trying to evaluate their system, number one, if it is functional or it is useful, and number two, if it is easy to use. Any person would look at those two variables and take them as true. And it's relative, it's quite true even when you think of anything that you take up. This theory is quite true. And so when it comes to the quantitative side, validation becomes, it's quite easy to generalize. But what happens when we are looking at very really qualitative approach, if when your research is exploratory in nature, what do we do? Because when it's exploratory, we are basically saying, I'm going to try and find out about this. We have very little information regarding this issue. So the fact that I'm going out to discover, it then becomes a bit tricky, and there's quite a lot of argument about, there's a lot of debate about this. It becomes a bit tricky to validate your research, to validate, to say, is this possible? Could this really be true? And I remember, I think it was Crippen who said, we then use the issue of triangulation. What do we mean? I gave you the example of my research, which was heavily qualitative, where I most of my data, I got it through, first of all, observation, ethnography method. I sat down with the community for about 2 years. I had participatory workshops using action research with health workers, training sessions. And in that time, I discovered certain variables in the context. Well, I felt I just couldn't come out and say, oh, well, this thing exists. There is limited mobile literacy levels. Well, that was my observation. Maybe it wasn't necessarily true, because I had 1 or 2 people say they don't know how to use the SMS application on a featured phone or a button phone. Is that really true? Can we state that as true? So what did I do? I then employed a mixed method approach. I introduced some quantitative tools, and these 2 particular tools were, one, I used a test paper, which I designed in format of what do they call it? Sorry, in form of the objective style questions, where you have a question and you only one answer. It's either A, B, C, D. One of them you select, and then from there I determined whether community members were computer literate or not. And this particular one, we distributed it to majority of the community members of Nindye Parish in Nkozi sub-county. So we had training sessions for 12 villages in Nindye Parish. Nindye Parish is made up of 12 villages, and as we went out to do mobile literacy training, before we did the training, we submitted a questionnaire, or rather not a questionnaire, sorry, a test paper. It was a questionnaire in the form of a test paper to determine literacy levels. That was 1. 2, to all the health, what are referred to as VHTs, village health teams, I distributed a questionnaire to try and determine if the things I had seen within the context were really agreed upon by everyone, that this truly exists. So what I was doing there was triangulation. Yeah, this is something Crippen pointed out in the last lecture. It was basically triangulation to try and determine that the variables that I had identified in the qualitative approach may or may not actually be present on the other side. So this is a good way to try and validate your research when your research is exploratory or descriptive in nature. This is a good approach to use. Ultimately, you still can't say for certain this is the truth, because you will say probably at the end when you're reporting your work, you say probably this means this, because it really hasn't reached that point of stating it as a theory or as a fact that must be taken as true. So then we come to the topic of credibility. Here we're going to talk about validation and so on and so forth. Credibility of research findings. So this is a key point that all researchers must come face to face with. And it starts internally with you, the researcher, where you really question yourself. Why? One of the things we must note as researchers, research must be objective. I think this was clear that when we talk about it being scientific, research must be objective and it must be, should I say, divorced from our personal feelings about something. I'll give you, I'll tell you a story of a session I attended, a PhD session at UMU. That time I was still a PhD student, so I attended this session and there were a number of people presenting their, should I say, proposals. It was still very much research work that was still at its infant stage. And I remember there was two examples of people that I can remember. There was one was a lady who was doing research on regarding land wrangles that stem from the history of the historical relationship between the Baganda and the Banyoro. Now, anyone who knows that history knows it's quite a volatile and can be quite sensitive subject, especially for the two parties, the Baganda and the Banyoro. It can be quite sensitive. Now, one of the key points I remember was that the researcher, while she was presenting her work, it was quite clear it was an emotional issue for her. And the people who listened to her, I remember this was the first comment they gave. They told her that, do you think this is a topic you really should be covering? Because it's quite clear it's an emotional subject for you. And automatically that meant this is something that she should not be researching, because emotionally she was involved and that was automatically going to affect her results, her reporting back. Let me also come to us who are in ICT and IS. Normally we design artifacts, innovations, and we are very much emotionally attached to our innovations. Anyone who has done ICT and IS knows that when you design something, your application, you're really proud of it, and you want others to be in awe of what you've done. But that's not always the case. There is the objective side where you may have to state, oh, this works, this actually does not work. This did not fulfill the intended objective. So the credibility of that research. The other story I wanted to tell you was in that same PhD presentation, there was a gentleman who was doing, I think he was doing his research on the origin of mankind beginning from Africa. And this gentleman, I think he was African, but he was born and raised in the United States of America. He was a Black man. Now, essentially what he was trying to do was using basically the culture, the nature of African, how Africans pass on their history through oral, through storytelling, and so on and so forth. He wanted to follow those storytelling to prove that human beings originated from Africa, and therefore, by doing that, gives some kinds of stature or should I say courage or encouragement to Black or the African American who is probably severely put down because of the the history of slavery and so on and so forth in the US. And that was another case I remember where the people who listened to him really said that, you know what, this particular topic, it's an emotional topic for you. Considering you're Black living in the US, this your research may not be credible, may not be considered as credible. So this is a key point in research. The stories I've given you are extreme cases, but whatever the case for any researcher, credibility is important. As you're considering credibility, think about all the people who are going to read your research. One, your supervisor. You need to prove to your supervisor the credibility of your research. So where does your research begin? One, it begins with you starting with a thorough understanding of your research area, the nature of your research, the nature of your problem, the problem you've identified. You need to prove that you have a good grasp and understanding of your research. That's one. One of the big mistakes most research students make is assuming that your supervisor is the one who makes or breaks your research. No, it is you, the researcher. You are the one who has identified the problem. It is you who must prove your clear understanding, and you must educate. Your writing must be clearly communicate and educate the reader. The first reader is your supervisor. That is the first reader. The second reader as your first and second markers, then your external examiner. And for masters, an external examiner is a must. Your supervisor actually does not mark you. I think from the UMU system, your supervisor does not mark you. It's your external examiner that marks you. So your supervisor's job is to ensure that you have logic. If it doesn't make sense to your supervisor knows it will not make sense to your examiner. So you must be clear and concise with your writing. You must be clear. You must have a clear grasp and understanding of your problem area. You must have a clear and a grasp of your method, your objective, and then your method. There must be a clear logical flow in all those components of your research. If you're going to write a publication, if your work is going to be published, and this, for any researcher, this is something that you must target. Especially at master's level, that your research work should be good enough to be published. So then the credibility matters. If you have a sponsor, also there it matters. Credibility matters, because the sponsor doesn't want to give something that money which is for something that is not valid. So when do we talk about credibility in research findings?
Question.
Yes, please.
In terms of relating to the work and not being emotionally attached to your research,
yes,
I might not be personally related to the research, but does it matter if I pick a topic that probably is in my line of work, which maybe I interact with every day and I see on a daily basis? Would that affect the credibility of my research outcome?
No, it doesn't. You would lack credibility if you are trying to push your agenda. That is when you would lack credibility. But as long as you prove, number one, that this was scientific, all your findings were based on the scientific process, that is a key point. That in sincerity, you followed the scientific process. You may have observed a problem in your workplace, that is good. Can you also generalize it? That the question I would put to you is, can you generalize this? Can you find this in literature? It may be a problem that, for example, I may do research on something in UMU. It may be a problem in UMU, but it doesn't necessarily exist elsewhere. You must be able to link it to literature. And after you link into literature, you must have identified a research, an objective, and then a research method to help you achieve that objective. Those are key points. So it doesn't matter if it's at your workplace, but begin by generalizing it. That's a key point.
Excuse me, madam.
Yes,
Thank
please.
you.
I've worked with some of the agriculture sector and pathologists in.
Sorry, Robert, you're breaking up.
Can you hear me?
Yes, now I can hear you.
I'm saying, my name is Robert. I'm doing ICT, and I've worked with research scientists in the aspect of agriculture, most especially pathologists now.
You said most especially in, sorry?
Main problems they used to have with research is finding out diseases, new diseases that would affect the crops, the plants of various species. And then, of course, they were interesting topics, but then they could find hindrances with finding literature to back their stories. And then this is where I want to ask you, because some of them could just leave the topics. Why? Because they could not find literature to back them up. And they could just find and go along with problems that could have literature that could back them up. So for the case of those that did not find literature to back their topics, which were quite interesting in science, in this kind of aspect, what kind of, how could you advise, if I'm a scientist and I would love to take that kind of course line for a topic that does not have enough literature to back it up? How do I meander around with it? Okay.
Now, when we say we can't find literature, what exactly do we mean? Is it to define the problem? Is it to find its general scope? Here's an example. Let me just give you an example of my research, which was largely exploratory, meaning little to no research had been done about it. What was that? That is research that focuses on an ICT for the artifact where a researcher says, I want to find out what works and what does not work. That was the key point. So essentially, there was barely any research the only research that I found as far as, because it was in mHealth, what research had been found in mHealth was applications which had been mobile applications that had been implemented, and most of them were the kind where they send SMSs to people who are on what do they call these diseases? Chronic diseases, and they are on medication daily or whatever kind of medication. And these people have to be reminded about taking their drugs because drug adherence is key. For example, those who are HIV positive, those who have TB, it's important that somebody adheres to their drugs, either one, to cure TB, or two, to sustain the immune levels of somebody who is HIV positive. So adherence is key. So the most mobile applications that have been implemented are those that remind patients. So what research had been done on that topic? What research had been done was to find out how effective they are. In other words, do they actually improve adherence? That research was there in mHealth. And for sure, I said, this is the research that exists. But there is no research that is focusing on understanding what works and what does not work. So Robert, in other words, what I'm saying is that in terms of my specific area that I was focusing on, that research wasn't there, that literature was not there because it actually hadn't been done. But there were other writings as far as mHealth applications that had been implemented. And that one I reported on it. And the key point of reporting on that was to show the need or the motivation of closing that gap. And it actually demonstrated the newness of the knowledge that I was bringing forward. So Robert, the key point is not for someone to abandon, but to point out in terms of diseases, let's say if it's a disease for maize, that the researcher would say, these are the diseases that have been found. This, and this was found in this time. This was researched on this time. This is the first of its kind. Maybe they're looking at the genetic makeup. The person, what they're reporting is the newness of this disease. But the literature review they would point out is what has been done, what has been discovered, so that by the time this person is bringing out this new disease, they're essentially saying, this is the new knowledge I'm bringing. I'm reporting a new disease. Robert, I don't know if I've answered your question.
Yes, thank you so much.
You're welcome. Now, let us come back to credibility, just discussing it a bit more, and we shall discuss it in detail in research design. What does it mean when we talk about credibility of research findings? One, it's on reliability. Will the results be the same in other occasions? Now, this is where a key point comes in for those doing qualitative research or exploratory research. This is where you may decide to point out and say, this was discovered, probably this means this. That would be a key point. Probably this means this for qualitative research. For quantitative, the reliability is relying on an existing theory. For example, I gave you if you did your research based on the TAM model, the technology acceptance model, because that one clearly states hypotheses, certain assumptions and beliefs. So that means that the results probably, because that is a theory that has been used extensively, that would bring about reliability of your findings. Similar observations reached by others, that is where we rely on other literature. Coming back to Robert's question, if your research is quantitative, that means it is explanatory, there must have been other observations elsewhere. However, let me also point out, even when you're doing an exploratory research, certain things are the same wherever you may go. I'll give you an example. When I started by identifying the things in the context areas, in the context area of a rural area that may affect, first of all, may affect the sustainability of an mHealth application. I started by describing a generic rural area and in terms of healthcare. It is abundantly accepted that in most developing rural areas, the distance between a health facility and the health seekers is normally huge. In most countries, whether you go to Kenya, whether you go to Tanzania, most of these countries, and this we can find simply from statistical data they have. For example, if you go to Uganda Bureau of Statistics, they have quite a lot of data indicating how many Ugandans live less than 5 kilometers, less or more than 5 kilometers away from any health facility. That data exists. And it exists for Kenya, it exists for Tanzania, for Nigeria, and so on and so forth. And you can draw similarities. And when you come to that, when you make that statement, it says most likely most health seekers in developing rural areas live a huge distance away from one another. So these are things that we can come in and we propose, even in an exploratory research, even from literature. So this can be things that can be observable elsewhere. Transparency of the raw data. Now, this is an extremely important point, and this comes also to a subject of ethics in research. It is quite common for a researcher, because they've run out of time, or they simply don't want to put in the work, to fabricate data. We know this, we've heard of it, where people are supposed to go out and collect data, but somebody sits under a tree and fills out their questionnaire themselves. That is a huge no-no in your research. And if once discovered, it can shut down your research in a big way. Why? What am I saying? I gave you the example of my research, which was exploratory. Somebody looks at any of my published data, they'll say, okay, I'm going to test out Sheba Nyakaisiki's research and find out if it exists elsewhere. Now, one, it could be I may have discovered certain things genuinely, but they actually don't exist in another context. That could be there. There's also the point where I may have fabricated data and it actually doesn't exist somewhere, and it nullifies my research. I'm sure many of you have heard in the area, I know it's a very controversial topic on the subject of homosexuality. Several years back, some scientists came up and stated that they've discovered from their research that homosexuality is biological, meaning somebody will have same-sex tendencies because of their genetic makeup. Well, other researchers came and disproved that, because they published their data. These researchers replicated that research and found it was not true. It's actually not true that homosexuality is because of our DNA. That research was disproved. So it is very possible for your research to be disproved, especially if it is going to be published. Now, whether your research is published or not, the transparency of your data is key. Ensure that you collect your data. Even before you collect your data, we shall discuss this in the research design also. The other part is ensuring that the tools you use are valid, or that they will collect the correct data that you want. We had a small discussion with Tom, where Tom raised the question that customer satisfaction, we may be trying to look at product innovation, yet customer satisfaction can be gotten with other things. Well, one of the key points is to ensure that you design a tool that doesn't collect for you irrelevant data. So that may affect. So there are several things we need to. So here in terms of reliability, consider these 3 points to ensure that your work is your data is reliable, your findings are reliable. Validity. So this one we shall discuss it in detail. Are the findings, if findings are really about what they appear to be. So this is another the subject of what Tom asked. This is validity. Generalization. Are we able to generalize our data, our findings to elsewhere? So quantitative data should be generalized, because by the time you're using theory, it means it has been identified over and over again. So it should be generalized. If it is qualitative data, you can make an effort to generalize, but only up to a certain extent. You can't generalize the same way as quantitative. You can point out other things elsewhere where it exists. I gave you the example of healthcare in rural areas, where I can pinpoint just from statistical data at national level that most rural areas in developing countries have an issue of distance between a health seeker and the health facility. That we can find from most statistical data at national level. Interpreting data. How do we interpret data to ensure there's reliability and validity? Where your work can be replicated by another. Would the same result be produced? So a key point in your research is to ensure that you state clearly, first of all, the originality of your problem, where it originates from. So you must understand clearly your problem and its nature. This is where literature review comes in. 2 is to have a very clear and appropriate research method. Yeah, very clear and appropriate research method. So that if you want your research to be validated or to see if it is reliable, somebody else should be able to replicate your research in another context. The other week when we met, I gave you the example of a student of mine who decided to validate a framework that was developed in a research in South Africa. The reason why he was able to replicate it is because the other researchers were very clear about what they did, their research process, their research problem, the nature of their research problem, and the method they used and the results they got. So reporting this reliably. 2, validation. Validation, you're looking at your approach. If you're using qualitative approach, try to use mixed methods to try and triangulate, to verify your findings. If you're looking at quantitative, then the validation guidelines that we shall have in research design will help you extensively to validate your work. So what exactly is validation? It is basically telling us whether an item measures or describes what it is supposed to measure or describe. So that the data we have got actually helps us to prove or disprove. The question Tom asked, if I went and got so many variables that don't really point to what I was trying to measure, then my data cannot be validated. If I have unnecessary or unrequired data, if I have tools that I have not tested, if I have a questionnaire that I didn't test, you may have a questionnaire that picks the wrong information or that may not be clearly understood. You may have information that has been wrongly input. There are situations when you give a respondent a questionnaire and the person is tired and just decides to tick only the first answer, and that is not valid data. Something like that. Generalizability. That this is external validation. What we've been briefly, I was talking about things like in the previous slides, I talked about things like your questionnaire. Is it well designed? Has it been tested? Making sure you don't select unnecessary variables. That is referred to as internal validation. External validation is when I try to generalize my findings with what exists elsewhere. That is external validation. If I found that the health seekers have an issue with distance, well, I can, to health facilities, I can validate that by saying, oh, for most developing countries, the statistical data actually indicates that the majority of their rural population lives far away. That is external validation. And this we can do with qualitative or exploratory research or explanatory. Whether it's qualitative or quantitative, we can try to validate this. Now, a very close relation to validation.
Hello?
Yes, please.
Yes, please, Doctor.
Yes, please, Crippen.
As we are sharing information,
Yes, please.
I also want to share one or two things before we go here on validity and reliability. Now, remember, if you are carrying out research, validity and reliability, they are quality control measures. How do you control quality? As the doctor said, credibility. They normally start with validity. And the way she said, validity of an instrument. Before you go in the field to use your tool, you as an individual, you sit down, design a particular tool. Now, once you design this tool, you don't have any guarantee that the tool you have designed is really good enough. So what happens? You subject this tool to a measure, which we call content validity index. When you are testing validity, now this content validity index, it measures if the tool has 20 questionnaires. Of the 20 questionnaires, which ones are valid? Are you using the correct English? Are you pointing to, are you focused on your objectives? Now, one of the methods you use to test validity, to test your instrument if it is correct, we call it judges method. For example, you can give it to your supervisor, you can give it to a professor, a person who is knowledgeable in that particular area. Now, this person is not going to tick the questionnaire. What is going to happen is going to look at the content. That's why you call it validity content. So you say out of 20 questions, which I've said, of these 18 are correct, which means it would be now 18 over 20 questionnaires. So what we are trying to measure actually is, before you go in the field, is your instrument good enough? So we are looking at the content of the instrument. From there, you come up with content validity index. Now, a content validity index, if it is above 0.72, then you can go ahead and use that tool in the field. Those are pre-testing. Before you go in the field, that's what you do. Now, for reliability, can you rely on the instrument you have?
First wait, where do you get the 0.12?
No, these are set terms. Let me just go ahead and explain to you, Susan. Like I said, if you design a questionnaire, you as Susan, you cannot be sure that my questionnaire is right or wrong. So what happens? You subject it to a test. And one of the tests, we call it judgments, the judges method. You get this instrument, your tool, and give it to, for example, Dr. Shiba. What doctor does is not going to tick in front. He's going to look at the content of this instrument. He says, out of the 20 questions, 18 are correct, which means 2 are not correct. That's judge 1. Then you give it to judge 2. Judge 2 will say, out of the 20 questions, 15 are correct. When I say 15 are correct, I'm meaning the English. Is your questionnaire focusing on the objectives? Now, if it is 18 out of 20, another one is 15 out of 20, then you get those averages. If you give it to 4 judges, you're going to get those ratios divided by 4. Now, the answer you get, because it's an index, if it is above 0.72, then you are allowed to go and use your tool. But in real sense, what happens when the doctor says this question is not right, then you go ahead and frame your question again to suit the objective of your research. That's the validity. Now, when you go to reliability, can you rely on these results? What happens before you go in the field? For example, if I'm collecting my data from Kawempe, what I will do, I will go to Gaise to pre-test my instrument. Now, we assume that people in Kawempe and people in Gaise, they almost live in the same conditions. Now, if it's an organization, if I'm testing, if I'm working, for example, for a Ministry of Trade, I can easily go to and Ministry of Works. You look for areas that are related. Here we are looking at reliability. Remember, your instrument has passed a validity test. Now it is going on a reliability test. My research is in Kawempe, but I will not go to Kawempe. I will go to Bwaise. Pre-test it. What am I testing? Have people understood the questions I have set? Is my English too complicated? Can the people really understand it? Now, once people in Kawempe, because in pre-testing we normally take like 20 or 15 questionnaires. Once people have understood, you have collected this information, like the doctor probably will guide us. You put it in SPSS and you run what we call a Cronbach alpha. Now, once you get that one, it will also give you a result. Now, if it has ranges, if it is above 0.7, then it means people in WISE have understood your questionnaire. Remember, this is a pre-testing. Now, it means your questionnaire passed a validity test, it passed a reliability test. Now, you are given a go-ahead to go in the field and collect the data. This time you are in WISE, now your area of study is in Kawempe, that's where you go. If it is commercialized research where you go in the field and collect data for an organization, actually, once you do a validity test, you take it to somebody who gave you the work and they sign on it. You do a reliability test, you also take it back and they sign on it. Otherwise, you're going in the field and collect information. And these people will turn around and say, these questions were not right. This tool is not the right tool. So for you to have the right tool, you carry out a validity and a reliability test. Then you go ahead and collect the data. The essence is, once they have approved your tool, it has passed these two tests, the quality assurance tests, these two tests, the information you collect will always be right. If it is a commercialized research, they cannot reject that data because it passed the stages. So, Doctor, that's what I also wanted to supplement.
Thank you so much, Krippen. I think, Krippen, you've really, really brought it home. Thank you so much. And I really appreciate that. I'm quite strong in qualitative research, not very strong in quantitative. And what Krippen has given is a very good guidance on validity and reliability in quantitative research, which is extremely, extremely important. Now, whatever the case, whether you're doing qualitative research and you basically want to triangulate your research, you do have a questionnaire. You really need to take it through the tests that Krippen is talking about. Those are key points. The qualitative side is a bit of a difficult part to validate, should I say, because you're more or less going out to discover, to explore, and you need to be flexible. You're guided by something. You will have an observation checklist. You may have an interview schedule. You may have focus group discussions, but you're more or less going out to discover. So the direction of your research needs some direction here, and may need to be flexible. So the flexibility, the validity and reliability becomes a little bit different there. Yes, Paul, you have a question.
Yes, thank you. So I have some sort of a question, and sorry, I'll take you a little bit back to the previous slide, 2 or 3, where I think Semugo asked about some sort of a bias to a research, where you give an example of someone, Black American, researching about the origin of people. And I'm kind of having a similar situation, and I need some sort of advice. So I work in a health setting, and the organization I work for has we have one of our objectives is to roll out what they call the Uganda Electronic Medical Record System at the facilities that provide HIV care and treatment and so on. And we've kind of had the uptake is not, the adoption is not as fast as we want it to be, or as fast as we would expect. And this is kind of related to some challenges by the users of the system. Some of these people, they're not literate with computers. Some facilities maybe have power issues and so on. And we have some regions that are actually doing well and some regions which are not. And recently, we wanted to understand, to study why is it that at some facilities and at some regions, in some regions, they're able to collect the data and report it, yet in some facilities, they don't do the same, or some regions. So we came up with some sort of a knowledge sharing session. So we call these implementing partners, like on a bi-monthly basis. And each implementing partner shares their experience, what is working in their area, what's not working, so other partners can learn from them. But we are doing this because we want to fulfill our obligation. We want to meet our targets. If the donor is asking us that you must roll out this system at this number of facilities and we are not meeting the target within the timelines, we want to push the implementing partners for us to meet the targets. So if I chose to do a study about the uptake of the electronic medical record system in Uganda, but I'm doing this based on my interest of wanting to meet the target.
Yes.
Without necessarily basing it on, because I have targets to meet, and I want maybe to prove to the donors to give us more money, probably, to make sure we achieve these targets. So if I wrote a document or a study about such a thing in a way that I'm pushing for the resources to fulfill the targets, does that disqualify my research or my study?
One, if you're doing, how can I put this? Research and seeking funding are two different things. I think that you can't write a research proposal to receive funding to carry out a certain research. But if your objective is to get funding, to get more funding from your from the donors, this is, I would say, the same thing as when I was head ICT. If I wanted funding for something, I would raise a report. I wouldn't give a research report. I would raise a report stating certain facts. If I know that this, if I put in this information, it's going, certain information will not get me the funds, I won't put it in. But this information will get me the funds, I'll put in that information. Now you realize that is a report intended to achieve a certain objective, but it's not research. Research, on the other hand, is quite different. Whether, remember we said, whether the result is positive or negative, we report it. So you will find that the readers of research are not the same as donors. The two are not the same. If I'm trying to get funding from a donor, my writing will be different. If I'm trying to publish a document, my writing will be different. So if you're trying to get more funding, that's not research. I would say that is a report. It's a,
okay,
yeah.
So
yeah.
Would you use some sort of a study to get the buy-in?
Yes. You would probably use some kind of study. That is sure. That is for sure. But there's certain information your study may have, but you will not put it there because, if I put this there, it's not going to get me the funding. Take an example. If people are not taking up they are not using the system because they don't find it useful, then you're not going to put that there because you want these guys to give you more funding to implement it. I don't know if you get that. Objective, if someone is rejecting the system because they don't find it useful or easy to use, that is a research finding. But if you specifically want funding, you will do a study maybe to find out what finances you need to implement. That we've run out of funding for this, we need to go and implement this, we need to provide more training. Maybe you give out a study to show how many people know how to use the system. You may leave out the fact that they have simply refused to use the system, but you may point out that these people don't know how to use the system, and therefore they need to, because they need to use it, we need to train them. You've left out the point that they actually don't want to use the system. Now, this one becomes, it is some kind of findings, but it's not completely true findings. So you cannot publish this kind of data. You can't necessarily call it research findings because you had a biased objective in this report. I don't know if I make my point. It is a report that there are reports we make, there are study reports we make for an objective. Then there are reports for research. The two are not necessarily the same. Paul, I don't know if I've answered your question.
Yeah, I think I'm getting it.
Okay.
Yeah.
Yes, Krippen, you had something to say?
No, it's not really a big one. I was trying to I remember what Mr. Tom was talking about, the satisfaction and innovation. And in one of the slides, you indicated that you cannot use a correlation. Now, in those...
You cannot use a what, sorry?
A correlation.
Yes.
Yes. Now, in those instances, it depends on how you are going to report your work and exactly what you want from it. Now, if you are rating, for example, innovation and satisfaction, your intention is to see if innovation is real, if satisfaction of whatever you are doing was as a result of innovation. There's what we call an ANOVA test, which will really help you to determine if it is true or if it's not true. Remember, every research is if it is most of quantitative researches are based on a hypothesis, which means you have to either accept or reject. Now, for you to accept or reject a hypothesis, you must have you must run an ANOVA test. That ANOVA test will give you the level of significances. Now, it has a range where those ranges will either allow you to accept or reject. Now, what Mr. Tom was talking about, how would I know if of these two, which one influences the other? Now, in that ANOVA test and analysis, the regression analysis, there's what we call a B table. You will easily know if I increased 1 unit of satisfaction or of innovation, how many people will be satisfied. So you run, it depends on exactly what you want. Now, when you look at what Paul was talking about, and it normally happens, you find your academic research, you want to get funding probably from office or from somewhere. Now, every system, if you implement a system, you implement it with objectives. We have implemented this system particularly to get A, B, C, D. Now, it is from those objectives that you come up with elements and dimensions. It is from those dimensions that you formulate a questionnaire. Now, depending on your art of presentation, of data presentation, because you are going, once you have a questionnaire, you administer it, then you come up with responses. Now, it is from those responses that you craft out exactly what you want to pick out. Because you could have the same questionnaire, but I pick a cross tabulation, which will give me a totally different result from somebody who has taken ANOVA. For it is possible, you can do it, and you actually get funding, because I've seen people who use their researches to get funding from offices and other areas. So it will all depend on the art of data presentation.
Yes.
Thank you.
Yes. Thank you. Thank you. And also, Paul, the research you're going to do is academic. So on the academic side, there may be research which you're presenting to donor. There may be research which, like Krupen says, which you may be presenting to your workplace for funding. There may be research which you're presenting academic. Now, the research on the academic side really focuses on objectivity. Objectivity is key. That's why even a negative result is a result, and it's necessary to report it. That is a key point. Okay, let's talk about the ethics in research. The ethics in research looks essentially at the respondents. Now, depending on the type of research we're doing, there is research that really, really requires, let's look at, for example, the COVID-19 situation. Vaccines have been developed. These vaccines have been tested on animals, on people. All those are ethical issues. There are ethical issues concerning that. If you're going to use human subjects, what is the guarantee that you're, number one, getting consent, full consent? By getting full consent means that somebody must have understood what it is you're doing to them. If I'm going to test a vaccine on you, do I know the risks? Am I willing to participate? There is a simple thing of getting information from you, but I haven't told you the full truth of what it is I'm trying to get from you. Is the person I'm asking information from, do they fully understand what it is I'm trying to get from them? I remember, I think I told you at the beginning of this research that at the moment, I'm involved with an organization, Palliative Care Association of Uganda, and we want to do a nationwide survey on palliative care needs for people with substance abuse disorder, people who use and inject themselves with drugs, the cocaine, the opioids, and so on and so forth. Now, when of course, I'm not a health person, but I'm a researcher. So one of my key responsibilities is trying to come up with a scientific side, the scientific components of research, to see what research method is possible, what is possible, what is not possible. What data can we get, what data can we not get? And I pulled out one of the papers, a published paper in that area. I think it was research done in the UK. And this particular group had targeted, the researchers had targeted 30 respondents. But in the end, they only got 9. Why? Of the 30, most people who are addicted to drugs, one, their cognitive levels you may find are extremely low. Somebody is really high and cannot give you a coherent answer, may not even understand what it is you're asking them. So if they don't understand, then how do they give me permission? Can you really say they have agreed to answer my questions, knowing fully what I'm trying to get from them? Others, these researchers reported they were highly distrustful of health workers and anybody in authority. Others were scared about, talking about their issues of addiction. So you found that in most of the cases, they couldn't get consent from the respondents. Now, if you can't get consent, that means you can't collect information from them. Those are ethical issues. Now, even you find that some of these research, before you carry out this research, you need to actually submit your research onto an ethics board, which needs to determine if you have actually followed all the processes that you need to ensure that your research is not going to harm anyone, that is going to protect information or the identities of people. Those are key points. Look at, I think it was my ICT class where I pointed out Uganda's Privacy and Protection Act. So this Privacy and Protection Act, one of the ideas behind it is research, collecting data from people that people may not be willing to divulge, information that they may not be willing to be made known, to be made public. If you look at the healthcare industry, I think Paul can testify to this. If you look at the healthcare industry, in Uganda, the issue of collecting personal healthcare information and putting it electronically is a huge one, where you find health facilities, health professionals are unwilling to collect personal healthcare records, because should these records fall into the wrong hands, you may have a hugely ethical and in most cases legal issue on your hands. So ethical issues are extremely important. For most of your research, it may not be required that kind of that level of scrutiny where you need to go before an ethical committee. But when you are dealing with human beings, you will be getting information from human beings. You need to have consent from these individuals. You also need to ensure protection of your respondents. Normally, you find simple things like on a questionnaire, somebody saying the researchers introducing themselves and stating the purpose of their research, and then explaining that I will not collect your personal data, I will not need your personal identification, so I will not report that so and so stated this. There's always that assurance that needs to be done. And then also ensuring that your respondent is willing to give you this information. From the literature review I was doing on the subject of palliative care and substance abuse, one of the key things that the researchers stated in their publication, that those people, though for those whom they did manage to get consent to go ahead and interview them, one of the things they ensured that they kept ensuring that that the respondent was in sync with whatever was being asked. That throughout the interview process, they kept asking the person, "Are you okay? Should we continue?" Because they were dealing with a very vulnerable group. They kept saying, "Is it okay for us to continue this interview? Should I stop? Are you feeling okay?" You know, things like that. Those are by the time they report that in their, as they report their findings, they are indicating the ethical frameworks they used to ensure that they protected the rights of the respondent. Now, you yourself, you'll find that you will write in your research ethical considerations you put in, that you asked all your respondents before you administered the questionnaire, or you sat down to an interview or a focus group discussion, whatever it is. You asked for informed consent. You protected the identity of your respondents. So essentially, when we're talking about ethics, we are trying to say that we are treating our respondents with respect, and that they are actually participants or stakeholders in the research. Another key point that is necessary is ensuring that you report back to the respondents. When eventually you've collected your data, you also must have a mechanism to report back to your respondents your findings, communicate back to them. A third point also is when you have official communication from, let's say, the faculty, which is sending you out to do the research, a letter introducing you that you're doing research, and this is purely for purposes X, Y, and Z. Yes, Susan, you have a question.
Yes, I just need clarification. Is it a must, especially I'm looking at the point you're on of ethics, is it a must when you're doing your research to hold on to information depending on the type of research you're actually doing? I'll use an example of the researchist, I think she was called Michael something from London, who did a research on Uganda, Rwanda, DR Congo, Kenya, I think. And while she was doing her research, she had to put herself in character, and you have thought that she should have held certain information, but holding on to certain information and not mentioning certain names would discredit her research. So for her research to gain credibility, she had to mention some of these names, and she also had to show where she got the information from, whether it was an interview, whether it was a questionnaire, whether she was in a meeting, whether she was having a drink up with these people and gathered the information. She had to give that information. So in such a scenario, is it must for you to respect the whole credibility? Respect the privacy.
The privacy. Now, the question is, was this an academic research?
The research was not academic.
Yeah, if it is investigative reporting, if it is investigative reporting, then it is probably important that the person states where they got the information from, because it could be a fabrication. But if it is academic research, it is extremely important that the identity of respondents is respected. That one is a key point. Extremely, whether no matter what type of research you're doing, let's say you're doing IS research, or there's somebody doing something as research as sensitive as, let's say, as homosexuality, or political affiliations, or things like that, or sexual abuse, those very sensitive issues. Whatever the case, the identity of the researcher, it is key that they are protected. In some situations, we don't protect. In some situations, it gives credibility. For example, when I was doing my research, I got some of my findings from key stakeholders in the field of mHealth. So at a certain point, I interviewed one of the somebody from UNICEF, who was one of the key people who was implementing an mHealth application. So I mentioned him and his position because this was a key person. But when I came to the community members, there I had to protect the respondents. There are some people, there are some cases. For example, if we're doing exploratory research and we are talking to experts in a certain area, maybe we are talking about your research is looking at mental health, and you decide to interview a leading psychiatrist. There you can mention, because the psychiatrist doesn't have a mental problem. He treats mental problems. He or she treats mental problems. Sorry for that. He or she treats mental problems. So you may reveal their identity. But if you interviewed somebody with a mental problem, then you don't reveal their identity.
Another question or
Yes.
example. For example, I am trying to do a research on Uganda Matters University.
Yes.
Yeah, my research is looking at e-learning, and I'm not looking at e-learning on the side of students. I am looking at it on the side of the lecturers and how well they have adopted the e-learning system. What is failed, what kind of lecturers have failed to cope, and why. If that is my research, would I still need to hold on to information? And if yes, how credible will my research be if I can't be specific?
Now, key point, let us say you are trying to understand people who have taken up, because there you're really leaning on the qualitative side. Now, in that situation, you code your respondents. Yeah, you code your respondents, and first of all, let's first go back to the issue of reliability of data. Now, in the qualitative side, Crippen gave us a very good explanation on the on the quantitative side. Now, let me give a good strategy for the qualitative side. When we are collecting the qualitative side, we collect a lot of information. You may sit down with somebody who may sit down and tell you about maybe why they've refused to pick up e-learning. Maybe the person will say, for me, I felt they were forcing me. At my age, I don't want to do this thing, so on and so forth. And you record, as you interviewing the person, you record. Either it can be written or it could be a recorded statement. Now, when you are beginning analysis of your data, you create a transcript. That means you type out everything that was said. What do they call it? Verbatim, word for word. What has been said by the person. Now, later on, as you analyze your data, you begin to create themes out of it. Let us say you said those who had the negative attitude, maybe the top, you may have a theme saying management enforcement of adoption of e-learning, that it created a negative effect. And here, as you're discussing this point, you say, respondent X, you'd have coded that person as respondent X stated, and you can even quote directly what the person quoted. Now, as you're handing in your findings, for quantitative, those who are doing quantitative research, you can physically hand in, first of all, the soft copy data and also the questionnaires themselves, which don't have the identity of the person. You, Susan, if you're when you're submitting your work, you can also submit the verbatim, those transcripts, which don't have the name of the person indicated. And also in your report, you indicate a direct quote from somebody, what they stated. That gives credibility because you're stating exactly what somebody said. Now, you're not stating their identity, but you're stating directly what they said. And also when you submit your final work, most people, like for me at the PhD level, I also went and showed them the physical papers, the questionnaires, together with also my transcript, my transcribed interviews and focus group discussions. Okay.
Now,
yes.
that is yeah. However, by me submitting the verbatisms that I've removed, the recordings where I've removed the personalities.
Yes.
In some research, like for example, if I look at some of the research we've done, organizations. Okay.
Sorry, Susan, you're fading off a bit.
That's saying, unfortunately, I can't mention organizations, but I'll call it X. Yeah. For example, I've done a research in organization X, and some of the research that they request for you to do is not just a research for them to know, but it is research for them to be in position to action upon your findings. And the only way they can actually be able to achieve positive results from the research you have done is by them having clear and unfiltered data. Because they have to look at each stakeholder at a time. Now, if I filter out this data, it means they are not going to know which stakeholder to go to. They will just looking at an entire department, which means while I have done a good research, I have given them more work than I should have.
Okay. Now, yes, Kripen.
There are two things here, and I wish we shouldn't mix them. We are looking at the ethics of research. Now, there is a government body responsible for handling this kind of research. You not just come from anywhere and you start doing research. The Uganda National Council of Science and Technology, something.
Yes.
It gives you authorization to go and collect research. Let it be IT, let it be social, let it be scientific research. There are structures, government structures, that allows you to go in a community. They actually give you a letter to go in a community and collect this work. Now, on the university level, a university also gives you an introductory letter. If you're going in an organization, if you are going in the field. Now, all universities are members of that government body. So if you are a student, you don't need again to go to the council to seek for another approval from the council, because once a university gives you a letter, it is also it does it on behalf of the council. Now, Susan, after getting that approval and you go in the field, it depends on what you are going with. For the sake of a qualitative research, we normally go with a focus group discussion or an interview guide. Now, if it's a focus group discussions are normally done in circles. You get a group of 8 to 12 people who are seated, for example, like in a round form. You record their names, but you give them codes, you give them numbers. For example, I can say, person who is seated on my left is going to be P1, P2, P3, up to the end. I have their number, I have their names, but when I'm reporting, I will not be reporting that Susan said this and this. I will be reporting using the codes as P1 and P1, P2, P3. Now, what happens? This person is going to give you a story. You record this story, you can be writing, sometimes you use recorders. Then you sit down and write these stories. Once you write a story verbatimly, you do what they call, you develop themes. Themes, they are small paragraphs. Somebody has told you a big story, but you don't need the whole story. You develop a theme which relates to your objectives. So you pick out a theme that goes on a particular objective. Even if you are using qualitative softwares for analyzing it, like Atlas, you develop a theme which relates to your particular topic. Now, if it is an interview guide works the same way. However, for it, you are not having so many people. It is a purposive. You are going to a particular person because he has unique knowledge or more knowledge in that area. If it's an organization and you are researching about accountant, you are not going to ask a gatekeeper. He received the salary from the accountant, but he doesn't have enough knowledge. So you go to the accountant, you go to the head of the department, purposively. Now, interview guides, you're not going to go with 20 questions, because these are close-ended questions. These are opinions. They are set in such a way that you ask somebody, Susan, in your view, in your opinion, what do you think? So somebody is going to elaborate. A focus group discussion, people were giving them codes. They were really telling you. In an interview guide, these are opinions, views of someone. Now, these views are recorded. They are also verbatim, but they are also, you also develop themes out of them. Now, this person, when you are reporting, you are not going to say, Susan said this. You can use their titles, like for example, head of departments, or you can also record them, give them numbers, then you put their initials in the appendix, not particularly the names. Then you also record the time when you did it. For example, if I get an opinion from Susan today, I will record it is on 7th, is it May or June? I will say 7th May 2021. Then I would just record it that I picked your opinion on this particular date. If I recorded Susan as S1, I would say S1 told me this and this. Then I go in appendices, I can just state, then the name of an individual, most cases is left out. So if you want more details, you can easily go and pick it. Those are academic researches. If they are commissioned researches for like an organization, they are implementing a project, then you can say, you develop clusters. For example, in one particular village, you call that one a cluster. So when you are reporting to the big people who gave you the work, you can say response from cluster 1A2. That means that is a particular person. But in your work, you know a cluster is a village called Kawempe. You know A1 is a particular individual called Susan. So that when somebody is looking at your work, you will see a flow of events and a flow of direction. So when in case they want an extra explanation, then they will come to you and be able to reveal the identities of the individuals. Thank you.
Thank you very much, Kripen. Susan, have you understood? Is it clear?
Confused me.
Okay.
Example was not based on like a society, yeah, where I'm gonna have people in a. No, my example is probably I'm looking like at an organization where you have specific, because I'm looking at quality and I am looking at specifics, because that is what the research is all about, and that is the baseline of the research.
Now
that is the angle I was looking more, as opposed to a general conundrum.
Yeah. Now, one key point that Kripen stated, if it is academic research, yeah, he gave the example of National Council for Science and Technology. The research that I was telling you about PICAO, it has to go through the National Council of Science and Technology for approval, because this is an organization under Ministry of Health and is doing a nationwide research. So approval has to come from there. And one of the key points is the ethical elements that we're talking about here. Those are key, and the protection of the respondent or the subjects is extremely important. He also pointed out that now at a university level, what do we do there? Well, every university is under National Council of Science and Technology. And normally, universities try to ensure, if you don't have, then you use another ethics committee. But every university should endeavor to develop a research and ethics committee to vet all research that is going through. All research must be vetted, that ethics is recognized. Now, for your particular, the example you are giving, that research is being done internally, and it's being done for the purposes of that organization. Is that true, Susan? Hello, Susan?
That is correct.
Yeah, so that one is being done for internal purposes. So for them, it may be necessary that the identity of the stakeholder is revealed so that a response is made to that stakeholder. That one is different. When it comes to the academic research, those ethical elements must be recognized. Otherwise, your research cannot be allowed to go ahead.
Question well answered.
Thank you. Okay, so I think actually, Crippen has really taken us quite a bit to the research design, but I don't know if we shall, but I think he has helped us with most of those points. But anyway, just to wind off on this, when we started the other week, we looked at that research onion, and I think basically we've covered all the layers that we can think of, starting with the research philosophy, the approach, the strategy, the time horizon. Now, to come to the very last one, which is the data collection methods. We have actually discussed most of them as in this discussion. We have looked at most of them, and we have talked about, we've had things like questionnaires, interviews, observations, secondary data, which is literature review, or actually getting aggregated data, which exists. Depending on what it is you want to collect, the data collection method should be in relation to your research method itself and your objective. When when you try to correlate it, which we just briefly, when Crippen was discussing about qualitative research, he said, if you're doing qualitative research, you may decide to say, okay, I'm going to have a focus group discussion. I'm going to, in that focus group discussion, I may go to it with an interview schedule. I may be doing ethnography research where I'm going to sit with the community. I may have an observation checklist, things that I may want to identify as I am there. You can also have a questionnaire which is qualitative in leaning, but this is normally left to quantitative side. So your data collection method essentially is pointing to your objectives. It's pointing to your objectives, and they must be designed based on your objectives. That at the end of the day, it is collecting the right information to answer your overall objective or overall research questions. Crippen, in his explanation, I remember, talked about when you're trying to validate your questionnaire, when you first give it to an expert who looks at your questions and looks at the content of your questions. Are your questions answering or leading to getting your overall objective? I remember again from, I think, Tom's question, when he talked about that you may want to correlate product innovation to customer satisfaction. That is the overall objective of your research. But your questionnaire may end up collecting other things that will distort or will disrupt the picture that you want to paint. So there, is your questionnaire, is the questionnaire appropriately designed based on your overall objective? What is the purpose of your interview schedule, interview guide? Is it guiding you that you answer your overall objective? Now, what is the objective, the reason for us going through these questions? At every given point, at every stage of your research, You are trying to validate your research. You are trying to ensure that you're following that scientific method, that you don't go off the rails. You don't go off the path that you're supposed to take to achieve your overall objective. From the point of identifying your problem, describing the nature of your research as you go through your literature review, selecting, clearly stating your objective, then moving on to selecting the appropriate research method, then going ahead and designing your data collection tools. At every point, you go back to your research problem. You go back to each stage, each component, to ensure that that logical line is being followed. At the end of the day, at the end of the final chapter, what you will be answering, what you will be stating to your readers is, have I answered my objective? Have I proved or disproved the hypothesis? Have I answered my research question? That is the key point you want answered. And your data collection tools are just as important as your research method, as your research objective, as the identified problem and nature of the problem. Now, in a nutshell, how do we summarize the entire discussion we've had? One.
Hello, doctor.
Yes, please.
Just kind of go back a bit on the last onion. Last slide.
Yes, please.
In my view, when they say data collection methods, there are two things. We have a method and a tool. A method, if it is a questionnaire method, then the tool will be a questionnaire. If it is an interview, if it's an interview method, if it's a documentary method, every method has a tool.
Yes.
And we normally have three methods: the questionnaire method, the interview method, the documentary method. An interview method uses a questionnaire. An interview uses an interview guide. A documentary method normally uses a checklist. That's something small I just wanted to clarify and share with you.
Yes. Thank you for that, Kripen. Thank you for that. If we go more to the qualitative side, the tools, the methods and the tools are even more flexible, much more flexible. I'll give you an example of one research that I had. The researcher present her work. This researcher came from Tanzania, and she did a purely qualitative research and ethnography. I believe it was ethnography. And she had one research subject. She had one research respondent, totally. She was researching on she was trying to understand, if I try to remember her research, it was some years back, I think maybe around 2007. She was trying to understand, her research was in the area of gender, and she was trying to understand the unique challenges and situations of women who are married, who are in mixed race marriages. So she specifically focused on one couple in Tanzania, where the woman, I think, was a white woman, and the husband was a Black Congolese man. I think he was some kind of celebrity in Tanzania. So what she did, she said, when she was narrating to us her research, she said she followed this woman. She basically developed a relationship with this woman over a period of 1 year. The respondent was aware that this was a research. So she was aware. So in a period of 1 year, this one basically lived her life with her. When she was going for her doctor's appointment, she was with her. When she was going to do this, she was with her for a period of 1 year. So now in that situation, these two, the data collection methods and tools were very loose, should we say. I'll also give the example of my research in mHealth, which was also based on ethnography, where I went to workshops and I simply sat there. I simply sat as these people, as these village health teams had their discussions, and I listened. I simply sat there and listened. Of course, I also recorded. And there were some sessions which were guided, some focus group discussions which were guided with an interview guide, which people responded to in groups, and I made my recordings. And then there were some sessions where I didn't say anything at all. I simply listened. And in that time, what I was trying to understand were healthcare issues from the perspective of a rural healthcare seeker. And I just simply, that is typical ethnography research, where you simply sit there and live the experience of the respondent. So that one is very flexible in nature, very, very flexible in nature. Can this kind of research be done in ICT and IS? Yes, purely. There's actually a paper I found where ethnography was used in IS research. It's possible, again, depending on the type of the objective of your research. But normally, as Krippen pointed out, we normally focus on these three areas. Interview, you have interviews, questionnaires, focus group discussion, and observation itself. But remember, I said, one of the key points I remember I raised in that first class we had, it is possible to have secondary data in the field of IS and ICT, just as we have in the field of healthcare, where you have aggregated data, let's say collected on HIV, on palliative care, on whatever it is. And you have researchers coming in and using this data, this secondary data, to research on something. Even on literature, it's possible to do that. There's what we call systematic literature review, where you can bring forward a point, but this may not be also groundbreaking. It may not be acceptable research. But however, like I pointed out, if we had authorities like UCC making periodic data collection in all sectors on ICT, then we can have researchers like yourselves going and using that secondary data, just like the data of UBOS is used by people doing social science research. It's also possible to collect that data. We don't yet have the mechanisms. We haven't yet put those structures, but I believe this one is possible for us to have. So just to conclude what we've been discussing, we have two main philosophical positions, and those are positivism and phenomenology. One is positivism leans towards quantitative research, phenomena leans towards qualitative research. The two main methods can point towards two approaches, deductive and inductive. As we discussed the previous week, deductive looks at starting from theory, and you start from a theory point of view, come to a hypothesis, then prove or disprove. You state whether something is true or in existence or not in existence. Inductive is the qualitative approach, where you come from a point of little or no knowledge or little knowledge, and you build theory based on that. Now, the two are not mutually exclusive, should we say. It's possible to combine the two, and it's possible to have a mixed method approach. Did I miss something previously? No. We do have, we went through the research strategies or research methods, so to speak, and there are quite a number of them. Key point to note is that for IS and ICT students, normally you will find somebody using the case study approach, design science, or action design science. Now, stating this does not mean that one may not use experiment, one may not use ethnography. If you look at the papers that I gave you, the literature I gave you, there's quite a number of research strategies that were used. One of them used action research. It is just that normally when somebody is developing an artifact, then design science or action design science come in. And normally people use the case study approach. So you can have more than one method that you are using. For example, one may use case study approach together with design science, or case study together with action design science. Depends. Somebody may decide to use action design science together with ethnography and case study. It is possible. So you don't have to use only one method. You can use more than one method. If you're designing an artifact for a particular, let's say, sector or organization, then there you're definitely using case study, and at the same time you're using design science. So we expect that both methods should appear in your writing, in your report. So like we state here, don't imagine that these are discrete entities that you use one method and don't look at others. No, you can use a combination of methods. Then research projects can also take the other methods that we looked at. Your research project can be cross-sectional or longitudinal. Cross-sectional means that you are looking at a specific area within a specific time. Or you can have a study that is looking at a period of time, let's say 5 years. Now here, this is where you would have probably used data that has been collected over a long period of time, either literature review or statistical data that has been collected over a certain length of time. Your research may be exploratory, descriptive, or explanatory. Your research may also have a multi-method approach. Now, for us to have multi-method approach, normally this is when we have qualitative research and we're trying to triangulate our results. Validation and reliability are important, whether you're doing both either qualitative or quantitative. Ethical issues are extremely important. It's for academic research. These are non-negotiables. So I thank you for listening. Quite a number of questions have been asked along the way. I also noticed that it's coming to 10, but if we have any questions, we have any question along the way?
None from me.
We've really had a good discussion, and I really want to thank Crippen for coming in. You've really been a great help. Thank you so much for that. Yes, Robert.
Madam, I don't have a question, but I just wanted to ask if you could share with us the videos of the previous recording.
Yes, but I stated, I mentioned at the beginning of the lecture that I have shared it with ICT. I'm just waiting for them to give me a link, then I will share it in Moodle. Hopefully by tomorrow they'll have uploaded it onto YouTube.
Thank you.
By tomorrow morning, yeah. Even this one, I'm going to upload it immediately after this lecture. Any other question or comment?
May I have it's not really a question about the lecture, but just about your research on the addicts. So did you guys put yourselves in character, or you weren't expecting those guys to trust you?
Now, we haven't yet done it. We are just starting. We are just starting the process, and we are, should I say, at the infant stages where we are questioning ourselves. The first two meetings we've had, we are basically asking ourselves the question. We said the first question they posed to me, because I'm basically supposed to guide, was we want to do a nationwide survey. And they were saying we want to have a questionnaire and focus group discussion. Then I immediately said, can you imagine giving somebody who is we said, do we first of all know that the state of the respondents? That's one. Then as we're going along the way, we said, as we start this research, one of the people on the team said, we really need to have a mental health expert on the team, so that this person can tell us realistically who our respondents are. So it's basically we are that in the initial stage where we are asking questions. Is this even possible? What is feasible and what is not feasible? And who can guide us?
I was following some work that was done by an organization in the Netherlands, and they were research on the drug users, not addicted to the like painkillers and what, but those ones that are addicted to like hard drugs, like And for these people to be in position to get good and valid data, they had to go to character. They had to socialize with these people. Some of them had to actually start doing marijuana because it was the stuff they could do. So they could the community, and it was the only way that these people could look at them as one of us
and actually open up to them. Yeah.
When you just with your suits and a nice car and a fancy pen and paper, they look at you as a threat.
Yes.
As part of them, you will get everything you need. And they will even ask you, put my name there. Make sure I am mentioned in this. But they, fortunately, let me see if I can get one of my friends in Norway to translate some of the research they did in English, because it was actually good research, but it's in Norwegian.
And actually
even in the papers, because that is when she gave us the story of what it was about and how it was in Norway. But that is the only way. So you guys have a very good project. You have a very good research to look at. It is actually quite essential here, but you need to be ready into character.
Yes.
And you also your own doctors who are going to be able to put a hand on you to tell you no, you've had enough.
Yeah.
because during the process of your research to get caught.
Yeah.
You're not with any good results.
Actually, for us to get any kind of results, when we first started discussing it, that's the first thing I said. Like, really, what information can we get? So it was one of the good things is that I don't know if you've had an organization, an NGO called Harm Reduction. I understand they are all over the world and they are here in Uganda, and they have inroads to them. So we are hoping to get quite a good bit of guidance from them on what is feasible, what is possible here in Uganda.
So under the funding of DFID.
Yeah. Thank you for that. Yes, please.
Now, the organization you're talking about, I think they're under the funding of DFID, because I know I've seen them on the DGF.
Okay.
But that's
you.
the one thing from your that I believe, while it's a good one, it will without any of you guys willing to actually get into practice.
Yeah. Thank you, Susan. Thank you so much for that. Okay, I notice it's coming to 10. So I don't think we're able to look at research design. I think what I shall do is just to easen up the burden of the online lectures is for me to do a pre-recorded lecture of this and also research problems then. But I think Crippen has given us a really good discussion. So most of what I'll discuss in research design is what Crippen discussed for us. So I'm going to do that tomorrow and put it up, but also this video plus the videos of next week should be up by tomorrow morning. So I hope that is okay.
Yes, please.
Okay. Okay. Let me just stop recording. Let me first stop sharing. So thank you